For me, wherever I see a pregnant woman in Uganda, I take them to be very vulnerable, and I know that if they are not taken good care of, they may end up dying. And that's what has been happening.
Can you imagine days you come and every day you're doing a ward round and you're telling patients, sorry, I can't operate you today, there is no linen. Sorry, tomorrow I can't operate you, there's no instrument. I mean, you feel that you've turned out to be a liar.
I would like to become a surgeon one day. So when I came here, it's as if I'm nearing my dream.
I feel satisfied, and I feel when I say baby come out and the mother is okay, so that we have two things, good babies and then healthy mothers. Then I think there, when I see that, I say that I'm giving something.
I think the sacrifice to get to that point, that to get to becoming a physician here is such an incredibly, almost insurmountable battle that it defines that person as who they are.
When I looked at the fact that we had very few health workers, especially obstetricians, I said, hey, I could be able to help out one or two people. I may not help out a multitude of people, but I said the few that will have the opportunity to come into my hands, I can contribute. And one most important thing was the number of women that were actually losing their lives just because of very few available health workers and resources. Well, I thought to myself that this pain that many families go through, and also the few health workers go through, the psychological pain of losing most of their patients, could be averted with time. And I decided to begin with myself, joining the obstetrics residency.
I think the uniqueness of the partnership with UCLA is the fact that we've had so many people come, I mean, from the US, but nobody has ever come up and just looked at women's health issues.
There is probably unlimited growth potential for the program. We have several ideas. One would be to create a training program for advanced pelvic surgeries that could really teach some people to have the skills to repair fistula, to take care of the cervical cancer cases that are surgically curable, and to help women with prolapse. If we could provide a few people with those skills, I think it would be a self-sustaining legacy of really improving the surgical care here.
One of the residents here is now becoming a specialist in this fistula repair, which otherwise would not happen. I think that's a lasting impact that you have. It's not just us swooping down and coming in saying we're here to save you. It's more of a lasting impact of how are we going to leave an imprint here for them to continue.
And then on another level, I think really trying to impact the maternal health outcomes and make sure that women don't die in labor. They don't die at home, they shouldn't die here.
Just keep trying to move. That's right.
They've had a tremendous impact on women's health, issues in this part of the country, and those women will forever be grateful.
And I think, for me, my prayer is one so that this collaboration really remains strong and strong and strong. In the future, will be other bigger things to come.
She's beautiful. It keeps you hoping. That's the best thing I can say. It keeps you hoping that something will happen, something good will happen.
The take-home point for me is that there is so much that could possibly be done, and each small step that you take makes a huge difference in an individual life. It's like the tipping point. You have to build up to this certain point and then things become self-sustaining. And in order to do that, you really have to make these initial small steps. You need to see a few people trained a little, and then you see a few people trained that much more. Then you start to see the whole system begin to come up and move forward. And that's where you're really going to see large numbers of women's lives changed. And I think that that's something that we can all feel really good about.
Uganda is definitely, we call ourselves a part of Africa. And Africa is real people, real people.
The Ugandan people are interesting in the sense that they are not broken. They are an incredibly proud, very hospitable group of people, and you say good morning to them and their whole face lights up with the biggest smile that you've ever seen. And it is a smile of people who have hope and who are truly happy.
So that's why I'm saying that Africa is a land of opportunities. Africa is very fertile ground, and Africa, any seed you give, you plant grows, and grows beyond your dreams and expectations, really. I think our healthcare revolution starts with each one of us, individuals.
It's hard, yes, but it still excites my heart that I'm part of this very seeming revolution. Uganda is a land of people with very bright ideas, with great dreams, with great visions and great potential, and all this needs to come out.
I think as more people come on board, yeah, it will start one day. We shall get there.